Welcome to the holiday edition of What Would Dayna Do? So we're here in my living room. We have our mantle all decorated for the holidays. We're super excited, and I hope that you enjoy your holiday season as well. Our question today comes from Janice. Janice works at a dental practice in Allen Park, Michigan. And Janice's question is, I would like some help and advice on HR. Rules on giving employees health insurance if they already have it under a spouse, leave of absence, and averaging hours for benefits when an employee has been on medical leave the year before. Lots of questions there, Janice. So since I'm not an HR expert, I reached out to my good friend and colleague, Andrew Lama. Andrew is with a company called HR for Health, and he helped answer the questions. So that I don't get the answers wrong, I'm basically going to read Andrew's answers word for word. So he's going to address the health insurance question first. And the rules for health insurance are governed by federal law and also state law. Although you are not required to provide health insurance to your employees, if you have less than 50 employees, you must provide it to all employees if you have a group plan so that you don't have any potential discrimination claims. If an employee is covered through their spouse, they will not likely to be covered under your plan, especially if they have to contribute. Our recommendation, the HR for Health's recommendation, is that you have your employees contribute to their health insurance coverage under a group plan as to avoid abuse. Inevitably, you will be asked if the employee can receive the amount that they would have been paid if they would have paid for their health insurance as additional compensation, since they are not taking advantage of it through your company, through the dental office. The decision on whether to allow this is up to you, but we recommend against it as it sets future precedent. So I hope that helps. If you have a question, please reach out to Andrew at HR for Health and he can further explain that answer. So the second part of the question was averaging hours. So let's see, we get to calculating average hours if somebody was on medical leave the year before. In situations of protected leave, we recommend that you look at the hours the employee is scheduled to work throughout the year and use that to determine if they should receive benefits. Protected leave is meant to ensure that they do not lose benefits while they're out. So as an example, let's assume that an employee is scheduled to work an average of 35 hours a week, but has been out on disability leave for 3 months. Let's also assume that the office provides benefits to employees who work more than 32 hours. If this employee returns, we recommend that the office give the employee her benefits because she is scheduled for 35 hours and would have likely worked those hours had she not been on leave. So it's important to note, this is from Andrew, it's important to note that both these situations need to be governed in your employee handbook, and why the handbook should be customized to your practice. So make sure that you have your rules, regulations, all your employee benefits written in an employee handbook. And Andrew at HR for Health would be more than happy to help you with those details. So I hope that helps, Janice, and hope you have a great holiday.